Hello, my name is Dr. Joe Nowinski. There are a lot of people suffering from drinking who aren't full-blown alcoholics, partly because we used to think in terms of two categories. People were either alcoholics or non-alcoholics. Now we know that there's really a spectrum that between normal social drinking and alcoholism that we call the almost alcoholic zone. And people who are in that zone really are experiencing negative consequences from their drinking in terms of their health, their relationships, work, and so forth. We believe that it is possible to shift out of the almost alcoholic zone back toward normal social drinking, and it depends on a couple of factors. One is how deeply into the zone a person's drinking is, and the second factor is how motivated they are to make those changes. So there are lots of people whose drinking is someplace in the middle and who are motivated to change, and yes, they can definitely make those changes. There are many things that people can do who want to move out of the almost alcoholic zone, and we offer many solutions, and they vary from things like literally taking stock of your life and where you're going and what your priorities are, to building a support network that will help you make those changes, to making very specific lifestyle changes and habits and routines that you do, to also learning different ways of dealing with very difficult emotions like anger, loneliness, and so forth. The key thing that we want people to understand about the almost alcoholic zone, if you will, is that most almost alcoholics typically do not make the connection between drinking and its consequences, between how it's affecting them physically, how it's affecting them at work, how it's affecting them in the family. And that it's really important to start to make those connections, and we help people make those connections, and then we offer solutions for getting out of that zone. The first thing that loved ones can do is to find their voice and point out the connections that they're seeing, as opposed to, say, not talking about it. So I think there's a connection maybe between your drinking and your health, or what's going on at work, or our family life. And then the loved one can actually help with many of the solutions that we offer in the book. For example, building support networks, changing lifestyles and routines. Loved ones can be involved in that solution just as much as the almost alcoholic.